I hope you are having a gracious day. Hello, I'm Suryansham Tiwari, a third-year production undergraduate from the National Institute of Technology, Agartala, along with my partner, Mr. Manisima Burma Manthena from the Manipal University, India. And it's a matter of honor for us to be presenting our innovation in front of you. We have chosen a topic which is highly common but has a dubious reporting in the real life. We are presenting you Autism Identifier, an innovative approach to quantify and monitor the movement of body parts of patients diagnosed with hybrid muscular disorder. Uh, so, for the problem statement, of disease study and an international collaborative project between WHO, the World Bank, and the Harvard School of Public Health has pinpoints muscular disorders as well as access to health. In 2001, the CDC report that approximately proved that 1 out of 45 children in the US are diagnosed with an autism spectrum disorder (ASD), according to the 2018 data. 1 in 25 boys identified with autism and 1 in 116 girls identified with autism. Active surveillance and estimation of proximal limb or other bodily parts functional impairments for the assessment have proved to be ambulation function, quality of life, and the life expectancy of the diagnosed patients. Statistical data proves that up to 1 billion people, nearly 1 in 6 of the world's population, suffer from neurological disorders and ADHDs, diseases, strokes, and multiple sclerosis, epilepsy to migraine and brain injuries. The existing solutions are not that much efficient. So if you see the existing solutions, those are long-term physical assessment of ambulatory behavior and joint movement, motion, expensive sensor-based electronic assessment of specific joints, and expensive laboratory tests. The current solutions are highly cost inefficient and address the issue indirectly. In clinical practice, active range of motion assessment represents a quantitative method to evaluate movement and the functional status of impaired extremity. This is highly cost inefficient, and it's a very hard issue for the patients. Now, we have also done a Fibonacci comparison to the current alternatives and the solution that if you see, we have compared the amount spent and the detailed output, and in which our SNMS project has been successfully demonstrated as the most efficient one. Now, presenting you the autism identifier, the solution to an existing problem that is ignored by the current society. Autism identifier is a very smart approach to actually quantify the movements and allows qualitatively estimating the muscular function with a systematic procedure. So what it does is it automatically recognizes the patterns, and on the basis of the patterns, it runs a number of codes and algorithms along that are embedded in the AI structure, and with the help of that, it predicts the overall output. Now, we have also used a data set to actually demonstrate the overall efficiency. So in this case, you can see it can clearly objectify and identify autism in very small children. So it is very hard to identify autism in infants. You will never know whether the small infant or the children is moving his or her hand because she or he might be happy or sad, or she might be suffering from autism. But with the help of this particular structure, we are able to identify the autism or the ADHD kind of neuromuscular disease successfully. And this has an overall efficiency of 89%. The advanced AI algorithm gives the approximate distance from the child from the camera without using the sensor. So this is the depth map, which gives the approximate distance of the child from the camera without using the sensor. This is obtained by the advanced AI model. This is the optical flow, which means it gives the analysis of by what speed the hands are moving and in which direction. Now, we've also done a cost analysis, and it is very efficient. It comes overall 10K USD. Now, we have also done an extensive research for the business and the revenue model. So we'll be using the STP model because the overall healthcare system is segmented, and for that we need a particular segment to actually work on. And along with that, we did an extensive research on the overall business Canva, and we identified our key partners to be hospitals, healthcare organizations, patients, private companies, and research institutions. and our overall cost structure will be based on human resources, storage facilities, IT personal research, and our revenue streams will be based on asset sales, users fee, subscription fee, lending, licensing, brokerage fees. The short-term implementation plan is very simple. We'll be focusing on the development of the AI interface, focusing on the development of the full-fledged ML interface, and we'll be focusing on marketing and pilot testing. Now, this is something that can be highly used for the rural area because it is very hard to give certain facilities in the rural areas, especially in third world countries, especially in the southern Asian countries like India, Bangladesh, Pakistan, and Sri Lanka. Thank you.